All right, welcome back to Sports Justice right here on Cyber FM Radio. We're being joined right now by renowned orthopedic surgeon Dr. James Andrews of the Andrews Institute. And Dr. Andrews, we just want to begin with, a lot of people, whether you're a baseball fan or a sports fan in general, you hear the word Tommy John surgery and you hear that, but not a lot of people know exactly what it is. Can you just give us a basic breakdown of what goes into Tommy John surgery?
Yeah, Tommy John, of course, is a famous baseball player who was the first one to have a reconstruction of the main stabilizing ligament of the throwing elbow, and that's the ulnar collateral ligament. And the operation and the ligament, of course, has followed his name, the Tommy John's ligament. Of course, Tommy was playing for the Los Angeles Dodgers and had a complete tear of that ligament. And back in those days, if you tore that ligament, there wasn't anybody trying to fix it. Basically, your baseball career was over with. And Dr. Frank Jobe was the pioneer, who was the team physician for the Dodgers, is the one that actually operated on Tommy and reconstructed his ligament. And, of course, the rest is history, that he was able to come back and have a productive number of years until he retired after that reconstruction. And the reconstruction basically is taking a tendon from your, we call it a spare tire, the palmaris longus tendon from your forearm that attaches to your wrist to the skin there. Really, it doesn't have a great function. You can bury it, and you take that tendon and you weave it across the inner side of the elbow from the bone across the joint to the other bone to reconstruct the ligament. And that's called a ulnar collateral ligament reconstruction, and that's now, of course, known as the Tommy John's procedure. But it's a reconstruction of the actual ligament using a tendon. And of course, that tendon then has to get a new blood supply and a long, drawn-out process to heal, and actually has to turn into a ligament. A ligament is attached from bone to bone across the joint, and the tendon, of course, has a different function. It's attached to a muscle belly and works across the joint to move a joint. So you're actually using a tendon to replace the ligament, and Mother Nature, fortunately, turns that tendon into a healed, reconstructed ligament, and that's a Tommy John's procedure.
Wow. There's a lot of speculation out there. A lot of people have different theories about what causes Tommy John surgery or what are the things that can lead to it. A lot of people say that throwing off-speed pitches at a young age. Some people say that throwing too hard. Some others say that too much time in the weight room. In your experiences, what have you found that is the leading cause of Tommy John surgery?
Well, you just hit the nail on the head. But as you can probably imagine with anything, there are multiple causes that will lead you to having injury to that ligament. And what we're seeing even in Major League Baseball pitchers is about 60% of them. If you take a close history and really look at their situation closely, you'll find out that they first had a minor injury to that ligament when they were playing youth baseball. So for me, prevention starts at the youth level, because a minor injury as a youth baseball player, say at age 13 or 12 or 14 or whatever, will lead eventually to a major injury, even if you get out of college and into the pro ranks. It becomes a major injury and subsequent the need for a Tommy John's procedure. But all of the above will be a problem. Throwing too hard, particularly at a young age, trying to match the radar gun at 90 miles per hour when you're in high school. By the way, that ligament in high school red lines at about 80 miles per hour. Red line meaning, if you have an RPM in your automobile and you go beyond the red line, you tear your engine up. Well, the same thing is when we talk about redlining related to the injury to that ligament. 80 miles per hour, above that, stresses the tensile properties, the forces that ligament can withstand. Those young kids in high school that are throwing 90 miles per hour are suspect to tear their ligament on any pitch. The big factor, though, that we found out in any of these cases is the fatigue factor. Now, fatigue, if I may give you a little insight into fatigue, fatigue can be event fatigue, meaning too many pitches in a baseball game. It can be seasonal fatigue, meaning too many innings in a season. And the big one that we're seeing now is year-round fatigue, meaning playing baseball year-round. And if you have any of those fatigue factors, and particularly if they all three add up, there's a 36 to 1 times. 36 to 1 times. That's 3,600 increased percentages that you can tear your Tommy John's ligament throwing a baseball.
Wow.
So fatigue is the big factor, and if you think about any of the things you just mentioned, fatigue is still the big factor in the injury production.
Wow, okay. Dr. Andrews, this is Paul now. I just have a quick question here.
Hey, Paul.
Now, when a player has a slight tear in the UCL, a lot of times we hear that they have to rehab for a few weeks. Now, how do you determine when they should rehab and when it's finally time to actually get the surgery?
Oh, boy, that's a tough question. You know, it depends on a number of factors. And to keep things simple, the degree of tearing, is it a low-grade partial tear? Is it a high-grade partial tear? Or is it a complete tear? Even in the high-grade partial tears, there's not a high percentage that they'll actually heal. So you've got to determine the extent of the injury, number one. Then you got to worry about the timing. When did this happen? Did this happen at this time of the year? For example, I had a young kid this morning that had a low-grade partial tear, college kid. We have about 2 months to see if he can actually heal his low-grade partial tear. Otherwise, if we get into the spring and find out that it hadn't healed, then he'll miss next year and probably some of the next year. He missed 2 years of baseball and probably be out of baseball. So we've got about 2 months in this case to watch him and to take him through a conservative protocol to see if he can really get through it to any degree. And if he can't, we got to go ahead and get him fixed. Otherwise, he'll miss. If you wait on it too long, you'll miss 2 years of baseball. So the timing of the injury has a lot of the determination as to how quickly you operate on them. But basically, if they're low-grade injuries, you'd like for them to have failed conservative treatment, meaning at least give them a trial of conservative care, which goes in 6-week intervals. A little minor injuries to the ligaments still take about 4 months to heal, and they don't all heal, for example. So that's a hard decision. And I told this kid's dad this morning, you'd have to have a crystal ball to give him an accurate percentage of whether it could heal without surgery or not. So all those factors go into that, into making that determination. And it takes some clinical knowledge and seeing a lot of them to try to give them the best estimate that you can give them. My rule is if you think that you're sitting on a fence and you can't quite decide is it time to operate on them, then you're probably better off to go conservative until it declares itself that it absolutely needs to be operated on. Otherwise, you'll operate on too many of them that may not need it.
Dr. Andrews, with that rehab process, what exactly is the matter of course that goes on? Is rest really the best option, or is it just a wait-and-see approach?
Rest is not a good word. You don't just, for example, you don't put a cast on them and let them heal for 6 weeks or something. You've got to keep their arm in shape, so it's what we call active rest. That means you take them out of the throwing of a baseball, and that's what's hard to do with young kids. They feel better in 2 weeks, and they call you and want to start throwing. So you do what they did get into what we call yo-yoing, meaning they rest a couple of weeks, they don't give it enough time, they go back and start throwing too quick, they get sore again. You rest them another 2 weeks. So you got to have a plan, and a plan is basically thinking that it's probably going to take them 4 months to get through it, and you reevaluate them in 6 weeks. And you got to get the player and the parents and the coaches to understand, even if they start feeling better, you cannot put them back out there and start throwing. Otherwise, you'll find out that you're just doing them more harm than good, and you don't allow the healing process. So they got to commit to what we call conservative treatment protocols, which we go at and look at in 6-week intervals. And most of them are going to take 3 or 4 months to halfway heal before they can really throw hard again.
All right, Dr. Andrews, this is Sean now. We just have a couple of more questions for you. If you were in a room with a bunch of, high school students and coaches and their parents and all, and you could just give them a little bit of advice on what to do to prevent this and avoid all of this happening, what would you say to them?
Well, the first thing is they need to understand the risk factors. And if you understand the risk factors, then common sense tells you what to do. But the number one risk factor is year-round baseball. So what do you do about year-round baseball? We recommend they need preferably 3 to 4 months off each year where they give their body time to rest and to rejuvenate and not get them into a fatigue factor where they tear their ligament or hurt their shoulder or both of them. So at least 2 months off each year where they're not throwing or doing an overhead sport. The other risk factor is playing in 2 leagues at the same time. Now that's a no-no, but you'd be surprised if you're playing with your high school team during the week and then a travel team on Saturday and Sunday or whatever. Neither coach has control of your fatigue factor or your pitch count or your inning count, and those kids wind up getting hurt. The other problem, of course, is trying to overthrow, and the radar gun is a problem. Now daddies have their own radar gun in the backyard. They try to take young kids and match them to 90 miles per hour. So we shouldn't be involved as young kids in how hard they throw, but teach them how to pitch and to pitch effectively to place the baseball. But if they're trying to match a radar gun, they get into trouble. As a matter of fact, my thought is the radar gun should be outlawed in high school and younger throwing athletes. I'm not sure that'll ever happen, but they got to really be careful trying to throw at an accelerated speed. The other problem is throwing more difficult pitches before they mature, and that means the curveball. Basically, we tell parents that they shouldn't throw a highly neuromuscular controlled pitch like a curveball until they shave. And the reason for that is that they don't have enough neuromuscular control as a young kid to throw a curveball with proper mechanics. And if they throw with poor mechanics, they get hurt. If they can throw it with good mechanics, our lab says that it's safe. But young kids that are in development phase, most of them can't do that, nor do they have anybody to teach them properly how to throw it. So poor mechanics is a problem in this age group too. So teach them how to have proper mechanics is important. The problem with pitching coaches is that it adds extra workload 2 nights a week to what they're already doing. So you got to be careful about their workload.
Right.
And if you know if you understand those risk factors, you sort of can take the safe route and protect your kid in high school and in youth baseball and hopefully prevent most of these injuries. Most of these injuries are overuse. At least 60% of them are overuse, and 50% of those are preventable with common sense. We can't prevent all of them, and we never will, but we certainly ought to be able to cut down on what we're seeing as of the last 10 years.
Dr. Andrews, do you watch things like the Little League World Series and just cringe because you see these 12-year-old guys and they're just throwing, and girls, throwing curveballs and trying to throw as hard as they can and things like that because it's on national television and everything, and they're really trying to show off their talents?
Well, I must say that I'm worried about that. I'm on the board of Little League International, and I was up there this Little League World Series for board meeting on Friday morning, and Little League is taking the stance of making the health and well-being of their baseball players and softball players as their number one priority. However, when you get to the Little League World Series, it's overboard, right. And they realize that. And one of the things that worried me this year, without criticizing, was the fact that ESPN kept announcing that what the radar gun showed for these kids throwing on TV. And we're making some modifications from that board meeting right now in the new contract we have with ESPN to curtail the use of the radar gun and emphasizing that by the announcers on TV. Now, I don't want to criticize them. They don't know. But to me, that is overemphasized and could be harmful. So we need to correct that. And that's just between me and you and my personal thoughts about it from a safety standpoint. And that's already been discussed at the Little League board meeting during the World Series this last time, the Little League World Series.
Right. Hopefully we see a change in that in the next few years.
Yeah, they're constantly modifying. You know, they took all of our pitch count rules that we developed through USA Baseball and American Sports Medicine Institute and our biomechanics lab and all of our studies, and they implemented those pitch counts. And by the way, they were severely criticized by parents and other youth leagues about those pitch counts. And the pitch counts that we initiated we've already been able to show that we had about a 30% decrease in injuries to the shoulder and elbow by using pitch counts. Other youth leagues, there are 25 other ones though that hadn't all followed suit, but I think the pressure is mounting. So they've been very proactive in trying to maintain the health and well-being of our young baseball and softball players. You know, baseball is supposed to be a safe and healthy sport, and we need to keep it that way. The other thing Little League has done is they stopped and followed our advice with rules where you can't be the pitcher, catcher, pitcher in the same ball game. And you see that done in high school. If you remember, that was done in that kid out in, I think, Washington State, where he pitched 15 innings. And when it came in with the game still tied, when they finally took him out, they put the catcher in to finish the last 2 or 3 innings. And by the way, guess who pitched the second game of that doubleheader? The catcher. Yeah, I mean, you just can't do that. So my hat's off to Little League for at least taking a stand, trying to get involved in prevention. And we all need to do that, and we need to make sure that parents understand the questions you've asked. You know, parents they mean well for their kids, but they don't understand the risk factors. I have parents come in with their high school kid to see me with a Tommy John's injury, and they're sitting there. We had no idea that he could get hurt playing high school baseball. How did this happen? Well, if you sit down and talk to them, it's easy to explain to them why it happened. Now, you can't always prevent the injury. You can't make the parents feel like they didn't take care of their kids, but we're trying to educate parents and coaches and kids alike so that everybody has an understanding, and that's where y'all come in. So I certainly appreciate y'all having the foresight to get this information out to your listeners, and hopefully we can help prevent some of these injuries.
Absolutely.
We appreciate the time also, and I have a multi-part question here for you. Now, when did you perform your first Tommy John surgery, and how has it changed since then? How will it change in the near future?
Well, you know, I learned from Dr. Frank Jobe after he did the original Tommy John's procedure. And I probably did my first cases in the early 1980s. And things haven't changed a tremendous amount. We made the approach to doing the procedure a little less invasive, a little not necessarily simpler, but maybe a little more complex, but less exposure. The real revelation in the procedure has probably come from early recognition, and the real advancement has probably been in the rehabilitation taking care of them post-op and learning exactly the time elements, when they can start throwing, what type of exercises to do, the development of the gradual, what we call interval throwing programs, and learning a little bit about how long it took Mother Nature to mature that ligament. It took Tommy John's 2.5 years, I think, to really get recovered. Now, it still takes a period of time. The old saying is you can't bargain with Mother Nature. So you still have to go through the maturization of that graft, which I said earlier starts off as a tendon and has to go through a biological healing response to become an actual ligament. So we'll never cut that healing response down to just weeks. It's always going to take the better part of a year, sometimes a year and a half in a major league pitcher to get them well.
Yeah. All right, last question.
We still got advancements that we're hoping for.
Yeah. Last question, and then we'll let you get back to your day. We know you recently came out with your Throw Like a Pro app. If you could kind of just walk us through the app and what it does for players and coaches, and maybe if you had any plans on releasing it for Android in the near future.
Yes, that app was released just as a preliminary for prevention of injuries in youth baseball. Now, we had a big conference call a week ago, and we're trying to take what we released and make it a lot more sophisticated with more video and more pure instructions for exercises, and to sophisticate what we were able to get out, because we had such a response with what we did, which was really a pilot study, a pilot program on that app. We also got to start adding new additions to that app, and the one that we felt like should be our next presentation is prevention of injuries in youth softball for the young ladies, young females. So that's going to be the next production that will come out on that app. Following that, that app also will tell parents, grandparents, coaches about a total of 100 different sports type injuries, what you do for first aid, the best treatment protocols, when they should go to the emergency room, all that kind of first aid stuff on 100 different youth sports injuries. So all of that's going to be upgraded as we can get it done from a time standpoint and the financial aspects of getting it produced. So we've got a lot more coming on that app that will make it the way we really want it to be able to do really a good thing for our young kids and for our parents and for our coaches. So all that's coming out over the next year or so.
All right, great stuff. Dr. Andrews, thank you so much for a couple of minutes here. We really appreciate it. Thanks for coming on here and help spreading the word. Maybe this can help prevent some of these injuries in the future. We really appreciate it.
Thank you.
Well, y'all do a great job. We appreciate being with you. I'll be glad to help any way I can at any time. That's a passion of my twilight of my career, is trying to keep these kids out of the operating room and on the playing field.
Great stuff, Dr. Andrews. Really appreciate it. Take care.
Okay, thank you.
Thank you.